Welcome back. If you're just tuning in, we're speaking about the massive changes happening in the healthcare industry and with market leaders who are redefining the rules of the road and the delivery model for patients, doctors, and institutions. So let's get back to the conversation. Before we get moving into some other questions, I really wanted to ask you guys, each and every single one of you, to define the term cloud, because a lot of people have different definitions of cloud, and I guarantee you, I talk to a lot of people sometimes and I bandy around the word cloud, and they're looking up in the air and saying, what are you talking about? So in terms of cloud-based model services, how do you guys define cloud-based services for our viewers?
So, to keep it simple, I would say that cloud is just delivered through the internet.
Okay.
I mean, that's simple. I mean, it's the ability through any mobile device, at home, a computer, through an internet connection to get to the application.
Okay. Would you define it exactly the same way?
It's pretty close. I mean, you really, the old days of the old mainframe and having to have your own server are gone.
Right.
It's much simpler just to utilize the internet, and you can actually expand upon your services much easier than having to worry about a whole bunch of thick boxes in the background.
In the background, and that decreases cost. Now, Penny, one of the things that I noticed is, in doing the research for the show, is I downloaded Blue Cross Blue Shield's app on my phone.
Oh, good for
it
you.
Was very, very impressive. So I take it that Blue Cross Blue Shield is definitely moving towards a cloud-based models for service delivery.
Absolutely. Whatever the cloud looks like, it has to be an environment where your health card is as secure and as ubiquitous as your ATM card.
Right.
That's what you're looking for.
Right.
And if it can be in the palm of your hand, it's that much better. And that's why our new app really puts a lot of power in the hands of member and non-member alike.
Yeah, absolutely. I thought it was very fascinating. Which brings me to my next question, which is for you. I am noticing what Blue Cross and Blue Shield is doing, something very different that smacks in the face of traditional conventions, so to speak. I haven't seen any other insurance companies doing that. And you guys are actually building standalone stores for people to walk in and talk or buy and purchase insurance. That's very fascinating. And I'd like to talk to you a little bit more about what is the goal for Blue Cross and Blue Shield, and whereas most people are moving away from brick and mortar stores, you guys are actually building them. Sure. What's the goal behind that?
Well, many industries are looking for ways that they can go to high tech and then only keep high touch where you really need it. Right. And what we've learned in the health environment that we're in, and especially with reform, we absolutely have high tech out there. But this is an industry that still requires high touch because the average consumer doesn't understand enough about the cost-quality connection in healthcare. One of the examples I use is, a Michelin tire, when it rolls off the line, is a Michelin tire. Now, it may get sold out of a Michelin store, or it may get sold out of a Costco. That's where the service model will change a little bit, but it's still a Michelin tire. Right. You don't have that cost-quality connection in the healthcare world. You really have to educate consumers and provide some transparency. When you need that knee replacement surgery, where do you go to get that? Which hospital has the most frequency? Which hospital has the lowest complication rate? A lot of people can get that information from high tech because we make it available to them through Care Compare. Some people want to talk to somebody live, and somebody want to look you right in the eye and make sure they understand what you're telling them. So the purpose of these centers is more about education, more about how to use your benefits well, more about understanding how to take care of yourself. It's really a place where you can learn to live well, choose well, and shop well.
Which is interesting, because what we're talking about with the healthcare reform and with this information-based superhighway is people want access to information. Whether they're talking to their doctors, whether they need a second opinion, they want that level of information. And I think you bring in a very good point. Some people will have access to technology and they'll be able to have access to that. But we also talk about a technology gap where certain communities or certain group of people do not have access to technology. And how do they get that kind of information?
Let me ask you a question. Do you think the guy walking around here with an iPhone or an iPad is one of the tech-savvy ones? Probably, right? Go to an Apple store and look how busy it is for that face-to-face, eye-to-eye, how do I learn how to use this technology better? Right, true. So it's still needed, even in a high-tech world.
Right, absolutely. So, which brings me to another question for all three of you. another major trend that's happening that I'm noticing in the marketplace is this thing that they call CLO-MOSO, which is an acronym for Cloud Mobile Social. More and more people are getting their information, and it seems that in my research that this is sort of like the infrastructure that is creating this healthcare ecosystem that we're talking about. How do you guys see that in terms of your personal businesses and the kind of healthcare ecosystem that's emerging? Do you guys see yourself using cloud, mobile, and social in terms of helping
Sure. I mean,
your clients?
We utilize Facebook, LinkedIn, and it's really about creating a community and a community of healthcare advocacy. So beyond what we do as a company of personal health records and online second medical opinions, the laws are changing. There's all types of let's say, like this month is men's fitness.
Right.
Last month was women's fitness month, and how all these different events tie into empowerment. You know, really, this whole movement in healthcare is about having the individual consumer realize that in the old days of healthcare was the doctor took care of everything.
Right.
It was all in his hands. You had to rely on him. Where 21st century healthcare is saying, no, for there to really be change, that shift has to go into the consumer's hands,
right,
and for the consumer to actually realize that he has the power. You know, I was at an event today, an organization that has 50,000 members, and I asked the same question, who owns your personal health records? And not one, well, I'd say maybe 10 hands go up.
right.
I own it, but 10 out of 500 people, that no one realizes that your health records belong to you.
Right.
The power starts with you, and understanding what that value means and where it takes you in terms of, you know, the cloud and social media and mobile apps. That's where the real control and power comes in, and again, it comes down to reducing those healthcare costs.
Now, it's the same question for you. In terms of, you know, cloud, social, and mobile, again, we talked about physicians being reluctant, you know, to perhaps move or migrate towards, you know, a technology that takes sort of the powers away from them. Or the idea that now patients can actually counteract a decision that a doctor says because, hey, I read it on the app from Blue Cross Blue Shield that I may not necessarily need that second surgery. So, you know, now hospitals or doctors may be saying, hey, my cost is about, you know, my payment may be going down because this person doesn't want to have a second surgery. So how do you marry that, and how do you handle that kind of, you know, adversarial situation?
You know, I think the cloud, mobile, socials, it's all good. And it's all good because if you really look at the challenges, we've all probably had loved ones in the hospital, or we've had some encounter with healthcare where it was very frustrating to see how nobody's communicating with one another. You know, I remember back a decade ago when my wonderful grandmother passed away, and her last, you know, 6-8 weeks, it was every doctor coming in telling me something different. I had to translate for my parents. It was a very, very frustrating experience. And so the whole cloud, mobile, social, I think it allows for a tremendous amount of collaboration. I think we can fix a lot of the communication, collaboration gaps that exist today and get the patients involved, get the doctors involved, and all the caregivers. And so I think that cloud, mobile, social is a wonderful thing, and I think that there's a reason why it's, you know, bursting at the seams everywhere and why everyone's jumping on board, because it really provides real-time access to good information. And think about, you know, being able to tell your physician, you know, rate your physician and tell your experiences. So other patients can tap in, other physicians can tap in. So I think it's a wonderful trend.
I absolutely agree with you. Now, in doing research again for the show, one of the things that I stumbled upon is the Deloitte company conducted a study called, Impact 2.0 study. And they were identifying 5 impact zones that are key areas in the healthcare ecosystem that they see changing radically within the next 10 years. And these converging forces, they included people, networks, markets, practices, and tools. Exactly some of the things that we're talking about here. So as these forces continue to merge and change the healthcare system as we know it, are we looking at an ecosystem that's going to be all-encompassing, maybe combining some of the things and services that you guys are doing within a portal system that people can have access anytime, anywhere within the globe? What do you think, Ms. Shaker?
Well, I think you have to. At some point, the general American public and probably global public is very attuned at accessing information quickly and really from their hand,
Right.
whether it's from a device or otherwise. And so I think it behooves us all to find the ways to make it, again, ubiquitous and secure.
Well, we're going to continue the conversation. We're going to take a quick commercial break. When we come back, we're going to continue the conversation about this healthcare ecosystem that is emerging and how you as a customer need to start taking power for your own healthcare. Be right back.